I got ADHD, baby. I set my goals, not your expectations, baby. I need my tools and a brain vacation, baby. Neurodivergent flow, no limitation, baby.
Welcome, everybody. Thank you for joining. We are going to be chatting today about ADHD and medication and all things that go along with it. And so feel free to utilize the chat function. We are glad that you are here. And if you're listening to the replay, thank you for listening to the replay. So I am Megan, if you don't know me. I am Megan. I run ADHD at work, where I help women thrive in the workplace and really truly identify who they are, and help them define success. And so we have our lovely guest here, and she's definitely making me feel like I probably should put a little bit of makeup on before I started. This is super gorgeous. And I don't understand how you do eyeshadow, but I'm going to need you to teach me offline. But please introduce yourself, and thank you again for coming.
Absolutely. My name is Naomi. I'm a psychiatric nurse practitioner. I practice in Virginia. I own my practice. I do a lot of work in ADHD. I'm also
I think
on the board of directors.
the sound might be a little muffled. Are you covering the?
Is that better?
Yeah, that's better.
Okay.
Go ahead.
I do. As I was saying, I'm a psychiatric nurse practitioner. I work in private practice. I own my practice. See a lot of ADHD patients, very focused on like underserved communities and women and that sort of thing. And I'm also on the board of directors with APSARD and participate. I'm the co-chair for the Women and Girls Special Interest Group with APSARD. So very, very invested in ADHD care and research and just trying to help spread awareness and reduce the stigma around ADHD.
Thank you so much. Thank you for doing all that work. I'm just responding to people in the comments that couldn't hear you for a second, but we're all set now. So yes, that is such crucial work, and so thank you for doing that and representing the ADHD community in that way, because we need all the support that we can get, especially with us currently being attacked in this current administration. And so this is unfortunately. But so I've been doing these IG lives, right? And so this is a casual conversation, but informative. And so I thought that in the current time that we're in, that ADHD meds is just a topic of conversation that we should all be talking about. And I will be fully honest, I have ADHD and I do not take ADHD meds, right? And so there's a lot of controversy that goes with it. And I thought that, the two of us having a conversation about just like what our experiences are with ADHD as it relates to ADHD meds and some things that we've heard from our clients or from own personal experiences, that we could kind of get into it. I hope that everybody that is listening is ready for this conversation too.
Yeah.
So one question that like kind of came up to mind is like thinking about some of the biggest concerns that we hear from clients, or just from our own experiences. It could be anybody really. And when it comes to ADHD meds, like why people take them and why people choose not to.
So why people take them is because they want to, they want to feel better. But, and then, of course we have sometimes where, they certainly are divertible. So sometimes people are taking them when they really don't need to. But if we're in a space where we're truly treating, patients want to feel better. And then a lot of reasons why people don't take them is because of a lot of stigma around them. Even persons that are kind of comfortable with taking, we've had a lot of shortage of supply over the past, it's been a while now, like the past 2 or 3 years now. It's been a little bit of a struggle with the supply chain. Sometimes just difficulty with kind of going back to that stigma thing. I've had patients say, oh, I go to the pharmacy and they give me a hard time, or they look at me weird. And sometimes patients have to like maybe leave town early, and so they need to go pick them up, 3 or 4 days early, and pharmacy gives them a hard time about it. And people just don't like being put on the spot like that. And then, of course, all medications comes with some sort of side effects, and some patients experience side effects, others don't.
Yeah.
But for some patients, the side effects are can be significant. So it kind of the side effects outweigh any kind of benefits that they might be getting. So then it's not the best option for them at that point. So
Yeah, and thank you for bringing up the stigma part. I have thoughts about both of those things, right? So like the stigma part, and then also like the impact that happens on your body when you take the ADHD meds.
hmm
But the stigma is so real. Like you should, knowing that you have ADHD and knowing what we know about the impact that ADHD meds can have on ADHD, right? And so in supporting a lot of people, the fact that you have to jump through hoops to get something that is going to
hmm
benefit you and it is known to be beneficial for a lot of people is ridiculous.
it is, and a lot of rejection sensitivity is part of ADHD, and so now you have this pharmacist that's like bearing down on you, like, and you have a legitimate prescription and you're here to get your meds, and now people are like worried about, is somebody going to question me when I get there? I've had patients call the office like in tears, and I'm like, what is happening? Like, I thought you were just going to get your meds, and then we have to have conversations with pharmacy, and more recently, a lot of pharmacies, so they are independent companies. They are definitely allowed to make their own rules. So as we transition more fully out of like COVID protocols and things like that, um, we have not gone back to the requirement as of yet that patients have to be seen in person a certain amount of times. But there was a lot of confusion about that because they would say we were, and then they take it back and extend it. So several pharmacies have made the decision that they will only fill for patients that have been seen in person within a year or within 2 years. And that's their own independent decision. And legally, yes, they are allowed to make that decision, but it makes it really hard for patients. It's
Really?
really hard for providers because we're getting calls saying, hey, I I couldn't get my med filled. We speak to pharmacy and they're like, yeah, well, we have a policy. Can you tell me if this patient has been seen in the last year or the last 2 years? And I'm like, well, that's not a requirement, but it is a requirement for that pharmacy. So it just added another layer of complication for patients that are already challenged with executive function things, and now you're telling them to now take another day to go back and try to do this again with some extra steps.
Right.
So it just becomes like a whole situation, and then the burden becomes on the patient to find a pharmacy that does not require that. It's just another thing, another layer that they've added. So that's another one of the reasons why patients sometimes don't take these meds, even though they could be beneficial. It's just being made harder and harder sometimes to
Yeah,
get them. So.
because now you have to find the right pharmacy, then go into the system, change the pharmacy into the system to make sure that the prescription gets sent to the right
Yeah,
place.
because we can't transfer them. So on my side of things, I have to go back in, switch the pharmacy, send a whole new prescription, cancel the one at the previous pharmacy, all of that. Because it's not like other meds where you can just say, okay, we'll transfer it across the street to whomever.
Uh-huh.
It has to start all over again. So yeah, yeah, just
It just
adds a
makes
little.
it unnecessarily
Mhm.
complicated um, for something that we know for a fact is supporting people, right?
Right,
And
right.
um, that's just really unfortunate. And it's true. It requires so many different executive functions. And so now you end up being like on the coaching side, like, okay, let's talk about all the different steps that are required
Yeah,
and all the ways in which we could get derailed just trying to get something that supports us, right? And
exactly.
um, that is, that's really annoying. Um, yeah, that's really annoying. And trying to explain your life to somebody that doesn't know you really has like is not a part of your medical team,
Right,
right? Like they're not,
right,
but
right.
now they're controlling how your own ADHD is being treated.
Mhm. And I think sometimes, certainly if you don't have ADHD, I think maybe, and I don't mean to sound like I'm like, like really giving pharmacy a hard time. I completely understand it. They have rules they have to follow. They have their own policies, procedures, all of those things, and I certainly respect that. But I think when patients go in and they seem kind of insistent,
Mhm.
that maybe comes off to pharmacy staff like, oh, this is a seeker, or this is, they just really want it. Well, they do really want this drug because they need to go to work tomorrow and they need to get their jobs done. They need to take
Yeah.
care of their families, and they need to drive home safely, and all of those types of things. So sometimes I think the patient's urgency comes off as something that it's not. It comes off as like almost like seeking behaviors, and in a sense they are seeking because they do need this medicine. So
Yeah.
then it goes all the way back to the rejection sensitivity, and that's why they didn't want to be on the meds to begin with, because they were afraid this was going to happen, and now we're here and it's happening. So it's just a kind of a circle of things that sometimes keeps people away from meds. So yeah.
Yeah. And so so when it comes to ADHD meds, we didn't really talk about this, but just there's stimulants and then there's non-stimulants. Um, and then I don't know how familiar you are. We didn't really talk about this offline, so I'm not sure how familiar you are with other pharmaceutical medications or
You mean like supplements and things like
yeah.
that? Vitamins, those sorts of things. So, I mean, I have some patients that utilize things like ashwagandha and
Hmm.
more things that are more just cognitively calming. So all of that
Hmm.
noise that happens with ADHD kind of calms down. I don't particularly suggest any. I don't necessarily discourage patients from using
Hmm.
those, but I don't suggest any just because I don't have any data, like specific data that says this works this amount of times, and
Yeah.
we don't have FDA approvals and things like that. So again, I don't necessarily discourage patients. If a patient tells me I've been taking this, they don't have any adverse effects, and yeah, I feel a lot better on this, I'm not going to tell them to stop unless there's a specific reason that I'm looking at that could cause you some harm. So,
Yeah.
I mean, I feel like if something works for this patient and it's a legal and safe thing to do, then absolutely use the thing that works for you. It doesn't, I was having this conversation with someone over the weekend, like it doesn't have to be a stimulant. It doesn't necessarily have to be a pharmaceutical. A lot of patients do very well with ADHD coaching or
Hmm.
therapy or just behavioral interventions and things of that nature. So um, I think that's another thing in the kind of ADHD conversation, that as soon as we say ADHD, everybody thinks Adderall or Ritalin.
Hmm.
Like, oh, that's the first step. That's where we're going. It doesn't have to be. Is it considered first line treatment? Absolutely. But
Yeah.
there are other options. There are behavioral management strategies and therapeutic measures and coaching measures and things like that that are all worth exploring. So yeah, just trying to support patients and looking at the whole scope of things that they can do.
Yeah. And when I think about my own journey around my diagnostic process, right? Like it was ADHD meds, and if I wasn't interested in ADHD meds, that was the end of the conversation. And unfortunately, that happens a lot.
And, and I think it does. I've heard that from patients. And in my opinion, that should not be. I say to patients all the time, this is a care team. You have to be the captain of the team. I'm here to advise. I'm here to tell you from my clinical judgment and training what would be good options for you. But I
Hmm.
can't force you to do anything. If this
Hmm.
doesn't feel like the best option for you, you absolutely have the right to say that. And then we look at what other options are. I refer to coaching often, even if they are on meds. I feel like patients should have coaching or some sort of therapy in place, because it's definitely pills and skills. It's
Hmm.
and explaining that to patients from a medication standpoint, this is not a magic pill. You're not going to wake up tomorrow and you're going to be perfect. No, that is not happening. We're looking for somewhere between 50 and 60% improvement at best. That's considered treatment success with a medication. So I try to get that on the table at the outset, that we're looking at best about 50% improvement from where you are right now. So do not expect to be suddenly this perfect person. That's where the skills come in. The medications give you enough cognitive capacity to employ skills. Whereas before, you're so disjointed that it's really hard to follow up on like coaching practices and therapy things and just to keep up with all of that. The meds will get you lined up enough so you can actually do those things.
Yeah.
But
Yeah.
it's not meds alone and I'm going to be great and perfect and my life will be great. That's not how meds work. So
I do feel like sometimes they sell it that way though.
yeah, I absolutely. I think they do. Yeah, I agree. But it shouldn't be. It
Yeah,
shouldn't
it gets
be.
sold that way. And sometimes, honestly, with people that have ADHD that are taking medications, kind of sell it that way. Um, and
Yeah.
and you know, is everybody really being honest? Like you are 50 to 60% better, but what about that additional 50 or 40, right, percent?
Right.
And that's when,
That's the
the seeking thing
behavior
and
change.
the
Yep.
behavior piece. And it's so crucial, right? And but then these side effects too. So like there's a lot of decisions, and that's the other thing people need to realize. Like taking ADHD medication is such a personal decision,
Hmm.
and there isn't a one right answer, right? And
Right.
so like I intentionally chose to not be on ADHD meds because I at the time that I was found out that I was diagnosed, I was also trying to get pregnant, and then I was pregnant, and then I had a baby, and then postpartum, and all the things that come along with having a child, right? And it throws your ADHD like all over the place.
Yep, the hormones
Um,
will do it.
um,
Absolutely.
but I personally decided to not go down the rabbit hole of trying different drugs
Mhm.
because of that. And yes, is there research around pregnancy and ADHD meds? Yes, but I also read it and I didn't feel comfortable. And so like that was my choice. And
Mhm.
like, I just hope that like people feel empowered to make a decision that works for them.
Right. And I say that to my NP students. I say it to colleagues. Like, present this in a way that patients understand it is a choice. I think a lot of times when they're sitting across from a provider, they feel like whatever comes out of your mouth is the absolute be all end all, and I have to do whatever he or she just said.
Mm-hmm.
And that's not the case. Like, we have to look at what your life is like. I say that again to especially every new ADHD patient. Every patient is different.
Mm-hmm.
How the treatment plan I'm looking at for like a 45-year-old male that, maybe has one adult child versus a 22-year-old female that has two toddlers and a 6-year-old and a spouse and is taking care of her mom, and it's a completely different treatment profile,
Mm-hmm.
and their decision making is going to be completely different. What that mom is concerned about versus what maybe an older male is concerned about is two different things. And so we
Mm-hmm.
can't say, okay, you both have ADHD, here's your Adderall. That doesn't fit for everybody. Like, it has to be individualized for every person. And to your point, it does change even for a single person, an
Mm-hmm.
individual rather, it changes throughout your lifespan. Like, at one point, medications might work for you, but if you are doing something like trying to get pregnant or have children, or then that time frame might not be a time where you want meds on board, and you might find that you don't want to return to them, or you do
Mm-hmm.
want to return to them. It's a lot of different places to be there, and making sure patients understand that that's okay, and
Yeah.
that's when we employ skills and we work around with other options, with maybe non-stimulants if they want to go that route. Lots of other options that don't have to be a stimulant.
Yeah. And, asking yourself questions around like, what are these side effects and
Mm-hmm.
how is the side effect going to impact the rest of my health? Or how is the side effect going to impact the rest of my life?
Right.
Right. And so
Right.
which
Yeah.
one
What's the
outweighs the
benefit
other?
versus the
Mm-hmm.
risk? Like, is it going to be enough benefit for it to matter? Like, I do take medications for ADHD, and I switched to one. It's been a while, but I switched, and I found that just the mechanism of action with that particular medication, I got a lot of like chest palpitations early in the day, and based on the way it works on its mechanism of action, that actually kind of makes sense. but it did not work for me. I was actually pretty focused. Like it did its job for like all the other stuff that I was trying to
Mhm.
not get distracted with. But now I was distracted with the fact that my heart was racing. so, so it did not work for me. I had to switch to something different because in that capacity, that just was not the right one for me, and it
Mhm.
didn't the the benefit, even because for attention and focus, it actually did work really well, but that risk of having those heart palpitations, the risk was not worth the benefit I felt like I was getting. So I had to make some changes.
Yeah. Um, what was I going to say? And just, I forgot what I was going to say. There's something that you said that just reminded me. I just feel like I just had my own ADHD moment just now.
Happens all
um, yeah, but just thinking about, there are, oh, that's what I was going to say. There are also the choices that you even have when you're coming to try, if you make the decision that you want to take ADHD meds, and then now you're asking some other questions, like, what is my health insurance going to cover? What options do I actually
Mhm,
really have
mhm.
based on what I can afford and what I have
Yeah,
access to? Because then that becomes a part of the decision making process too.
it absolutely does. A very frustrating part of it for and for patients, but it absolutely does. It depends on, which plan you have, and all the plans have different plans within that company, and it can be different per plan within the company. Some plans require that you have a drug screen within 60 days that's on file. Like, there's a lot of different rules that we as providers on the other side have to be knowledgeable of, because I do that all the time with patients as we're kind of approaching that. Okay, what treatment are we going to choose part of the appointment? I am looking back through their chart to see what insurance they have, unfortunately, because it matters.
Yeah.
It matters, because I don't want to tell them about a medicine and then look back and go, oh, but you can't get that one. Like, that's the worst thing that you can do to a patient when you've got buy-in, and they're ready to go, and then you look at it and go, oh yeah, but your insurance is not going to play ball with this. So I have to look back and see who what plan they have, who covers what. I keep like a spreadsheet that has like, okay, this company will cover this, this, and this. If I want this other one, they have to have already tried this. So you have to keep this whole little algorithm thing going. But it's very frustrating for patients. And I found some patients that there are formulations like patches and chewables and liquids that would be a better option for some patients. But
Mhm.
those are the ones that are usually the harder ones to get approved with insurance companies. And so we go back to that benefit versus risk conversation. Is it worth all the time and frustration for the patient and for the provider to jump through all these hoops to try to get the thing that we all feel like would be better? Or is it better to just get this patient medicated on what they will pay for out of the gate? So
Everything about this sounds exhausting. Like that, my ADHD brain is like, forget this. I'll just drink a cup of coffee.
and it becomes a almost like a art. Like I can look at most insurance companies and I know what they will do and what they won't, or what thing the patient has already had to do in order to get a certain thing. Most companies are pretty okay with medications like dextroamphetamines um, and your basic Ritalins. It's the newer things like most medications that they give us a hard time with.
That just
But
sounds
yeah,
frustrating too, for as from the provider perspective. It
mhm.
also feels very, very frustrating to have to deal with that. And like you're training providers too. So now you're trying to also explain the chaos
Yeah.
to a whole other
Yep.
generation of
Yeah.
providers that are trying to support
Mhm.
patients that are also frustrated with this process. So it's,
Right.
it's also can sometimes be a bad game of telephone. This is like you're not trying to,
Yeah.
you're just trying to train without putting in your own bias towards
Right.
the
Right.
situation, right? And so you're just trying to be like, this is, it's just complicated.
It,
Like it's complicated
it
to be
can
able
be. It
to
can be.
access. It's complicated to prescribe because of all of these different entities that are
Mhm.
involved in the decision making process. Like
Yep.
you wish that you could just make a decision for yourself, but the reality is it's like you're
Yeah.
making a portion of the decision. And then some random person on the end of the phone is making it.
Yep. Somebody's following the algorithm, and if it lands on yes, then it's a yes. If it lands on no, it's a no. And then, we can go through appeals and all of that if we need to, but that's time consuming. And this is for patients that need to be treated right now. This is not like we
Yeah.
got a week to wait. Like, no, we need to treat this now. But sometimes it's not always that easy.
Yeah.
Unfortunately.
So when thinking about stimulants versus non-stimulants, what are the pros and cons, I guess?
So stimulants are considered first line. They have some of the best efficacy data of any medication in all of medicine. We know they do work for the symptoms of ADHD, and they work quickly. I often explain them to my patients as they're kind of a one and done kind of med. You have to take it today to have the effects of it today. Now, does it have like a cumulative effect? In the sense that the longer you take it and the more organized you're becoming from a thought process and cognition kind of standpoint, you start to get routines in place. And so you see the longitudinal kind of benefit that way. But you need to take the medicine that day for it to work.
Mm-hmm.
With the non-stimulants, you do have to take it for a few weeks before you start seeing any significant improvement. So if maybe it's a milder kind of case of ADHD, or the patient has enough insight that they can really work well with behavior changes right now, and
Mm-hmm.
we can work on that for a couple of weeks while we're waiting for the meds to onboard. Or if you're a patient that for some reason stimulants are contraindicated, like you have a cardiac issue or seizure disorder or things like that, any reason why we can't put stimulants on board, then the non-stims are a great option. Some patients just choose non-stimulants because they just made the decision that I don't think I want to do the stimulants. Let's try this, but I'm willing to wait the 6 to 8 weeks to see how well this will work, which is an option as well. So it just depends. Again, it's more individualized on with each patient
Yeah.
what's going to be best for them. Yeah.
We had a question in the chat that said, it seems that many ADHD folks have sleep issues. What are some treatment options that help? And I'm assuming that's also around when you're taking a stimulant,
Hmm.
there's some sleep challenges. And so it's like you're awake and then it's like you take an upper and a
Yep.
downer. What happened?
So certainly, I always tell my patients, don't take your stimulants after 11 a.m. If you missed it, if you slept late on a weekend or something like that, then just don't take it that day. Or I tell patients too, set your alarm for like 7, wake up, take the pill. If you're going to go back to sleep, that's fine. But you got to get it in your system early. Otherwise, it can affect your sleep at night. But one other kind of interesting other side of the coin with that is that we find that actually for a lot of people with the ADHD and sleep issue, it's actually that the med has worn off at night as to why they can't sleep. Now they're back to I can't shut my brain off. And so I have patients all the time say I can't sleep. And when I ask them why, they're like, well, my brain is just going, going, going. That's because the med has worn off. And there's even conversation around should we put a little tiny dose of stimulant at bedtime, because
Oh,
that's the only thing that usually turns persons with ADHD, that turns that brain off. So what we really want is for the med to be at its peak for the majority of the day when all of your responsibilities are there, and then just be um, falling below a therapeutic level as you're ready to go to sleep. We still want a little bit on board because that's what shuts your brain off and lets you go to sleep, at least for a person with ADHD. Routines, very, very important. So sleep hygiene routines, training your brain that every night I take my shower and I brush my teeth and maybe I read this book. I even tell patients, if Candy Crush is your thing, turn the backlight off on the phone, and if it's Candy Crush, it's Candy Crush. But we got to put some parameters on it. I don't want you on your phone all night, but whatever is your routine, stick to the routine. So it will
yeah.
start to train your brain that I do this, I do this, I do this, and then I go to sleep.
Yeah.
I do this, I
Yeah.
do this.
I think I've officially trained my brain. It
Yeah,
took a really long
it
time.
does. It does.
It's a really long time. I mean, it's complicated when you have a small child because you're
Absolutely.
just up anyway.
Yeah, for
Sleep is
sure.
like out the window. And so I think after the trauma of just being awake all of the time with the baby, my body's like, oh no, sleep is actually, we're just gonna calm down now because it's
We're gonna take
um
advantage of this moment where we can
yeah,
do this.
it's like, oh, you have the opportunity to close your eyes? Oh, we're gonna take advantage of this. And so yeah, so I feel like the having a child has definitely helped with my sleep
Yeah,
conversations that I have with myself. Because I know what real exhaustion is now.
yeah, yeah.
Um,
But it is definitely true that sleep is a big issue with ADHD. And we do kind of have to balance that. Is it too much stimulant on board that has kept me awake, or is it that I can't turn my brain off? So I usually ask patients that when you can't fall asleep, what's going on? Are you staring
mhm,
at the ceiling like, oh my God, I wish I could sleep? Or is everything about what you have to do tomorrow and what you did today and your conversation with your workmate, is all of that running through your head? If they're
mhm,
staring at the ceiling and just wishing they could go to sleep, it's more likely too much stimulant is on board and maybe you took it too late and it's affecting your sleep. If your brain is just going about tomorrow and today and everything else, that's the ADHD. Like there's not enough left on board for your brain to just calm down. So, um, other options like lavender, a lot of people do really well with. There's that the brand Calm, I think it's called, that has a lavender
uh,
mix that a lot of people do really well on too. So that and melatonin, but keeping the dose lower, like around the 2 milligram area. Like I see people come in and say they're taking as much as 20 milligrams. That's
ooh, that's a lot.
that's not where we want it. We want it and more around like that 2, maybe 5 milligram range. And another thing that I've heard specifically about melatonin, picking not only a specific brand but a specific store, because there was a study that was done that looked at over-the-counter melatonin and found that the dosing varies widely. Like it just depends on what factory it came from and like what vendor that store buys theirs from. So not even just the same brand, but the same brand from the same store, and you're more likely to get the same dose you had last time. Because just because the bottle says one thing, it might there's a gradient, let's say, on what's really in the dose. So that was some data that was presented, I think, well, not this past year, but the year before that about melatonin. So being careful with that because it can be a little maybe a little inaccurate on the bottle.
I
So
did
because I've
not know
had
that.
patients, yeah, I've had patients come in and say I've been taking this melatonin for years and it always worked before, and for some reason it doesn't feel like it's working anymore. But they used to get it at the Walgreens on this street, and then they got it at Walmart this time, and I'm like, it might not,
That
it
sounds
might
like
be
it
a little
should
different.
be a problem. I mean,
So
that sounds like it should be illegal. Um, I mean, but
yeah,
it's the same thing with like a lot of like nutrition labels. Like
mhm,
there's for certain aspects of the nutrition label, like zero. What is it? What is it's not cholesterol, but it's the saturated fats. I think it's saturated fat. But saturated fat, like zero isn't really zero. Like
right,
you can have a certain amount of saturated fat and
and
consider it
still
zero,
say
and that
zero.
and it's
Yeah,
still to zero on the label. But if you eat a bunch of products that have zero saturated fat, it doesn't mean that you're not getting any. You're actually like it
right.
accumulates.
So yeah,
This
that's
is so
one thing to
irritating.
consider. But it's most of it is the routine. Create the routine, try to stick to the routine. Have like, if you have a partner or roommates, like have that kind of buddy system. Like we all agree lights off at this time, like training your brain to
Yeah,
calm down,
and
putting away stimulants.
um, I try to teach my clients like around effective habit building and like creating a cue. Like, what is your cue? What is your routine? And what is your
Mm-hmm.
reward?
Mm-hmm. Yep.
And so, really being clear about what those things are, so then you can create a new habit, right? And so, like for me,
Yep.
like once my mind starts to go racing crazy, like that for me is a cue.
Okay.
So like once I notice that, I'm like, okay, I'm stressing out about nothing or everything, and that's the trigger for me that says, okay, you need to do something else because, once you do this thing, then you're going to be fine. And so then I have a couple of different go-tos
Yeah.
in order to quiet my mind,
Mhm.
and then I can go, then I fall asleep right after that.
Yeah, and I think that's the value in therapy and coaching because from a provider side, in follow-ups, we probably have, I mean, I own my practice, so I can be a little bit more loosey-goosey with time frames, but we probably have at max maybe 30 minutes. And once we've had a conversation about the medications and what we're going to do there, there's not usually a load of time left to really work on techniques and different interventions that you can do, like you said, like creating a cue, helping identify triggers, like all of those things. Sometimes the time is not there, and then like you mentioned, your experience was it's like, okay, here's your meds, out the door, like, and that's not going to be effective
Mm-hmm.
as a whole holistic kind of plan. So I say to patients all the time, we need to get you with an ADHD trained therapist or an ADHD coach, someone that can support you, if possible, if it's, within their capacity from a scheduling or a financial standpoint on a weekly basis or bi-weekly or at least once a month, because ADHDers are also very much out of sight, out of mind. So as soon as they walk out of the office with me, they're back to everything else that's going on in their life. And even if we did make a plan in the appointment that day, their brain just doesn't work that way. That they have so much else going on. So
Mm-hmm.
if you can meet with somebody week to week, every other week, because also ADHDers are worried about being judged. So if they know someone's going to check on them, they're more likely to do it, and then it just builds habits, builds habits, builds habits.
Yeah,
So
and especially if they leave your office after going through all of this content, all this information,
yes,
they're trying to absorb it, and then they get to the pharmacy, and then it's drama there, and
exactly.
then it's drama and trauma, right?
Hmm.
So it's, and then what do you do? Like, do you actually go back to the MP? Do you get some additional supports, or do you just say, you know what, this is why I did do this in the first place?
Exactly. And now they're emotionally exhaused, they're
Hmm.
tired, and it's like, I don't even think this was worth. I feel worse now than when, when I went in. So, and then it becomes, I don't even know if I want to do this. So, preparing patients for all of that, trying to give them very digestible amounts of information, even though, again, from our side, especially initial appointments, it's a lot for them to take in and process and walk away and think about all that, which is again why I like a handoff to therapy. If they're already in therapy, great, but also a therapist or a coach that's well versed in ADHD, because there are a lot of different modalities that a lot of people are good at, but you have to really understand and know ADHD to be, I think, the most effective with patients that are living with it, because they're not necessarily going to be able to follow a typical CBT kind of treatment algorithm, or because it's just not the way their brain works. It's not anything wrong with that. It's
Hmm.
just we need to look at other tools first so that they can take the best advantage of those other tools. And sometimes that's not as understood by all on the team. So yeah.
Yeah, so essentially, accessing ADHD medication is extremely complicated.
It can be complicated, but I think working with someone for patients, if you're going to seek care, be okay with asking when you call that office, is this someone that works, at least a fair amount with ADHD? Is this someone that, so you can get an idea, read the website. Do they just happen to list ADHD in a long list of things that they treat? Or do they take, like, is there like a paragraph where they talk about ADHD, or you see that they're a part of associations related to ADHD? And that kind of makes it a little, even maybe a little bit more challenging, because it might be harder
Yeah.
to get an appointment with that person. But trying to get connected with someone that is very invested in ADHD, because then they will know the easier, they can kind of guide you on an easier route. I say to patients all the time, like they put in a pharmacy when they make an appointment, but I might look at that pharmacy and say, hey, you mind trying? Because I happen to know it's a little easier to get to get in and get out in that pharmacy. From talking to you, it sounds like life is busy. We need you to walk in, grab your meds, and head home. So do you mind trying this other pharmacy? Or I will know just from looking at it what medication to start with based on your insurance company. And so working with someone that has been down that road and goes down that road a lot, so we know how to guide in that capacity.
Yeah, having that insight is really important. And I didn't know that that was information that you needed to have. And so now trying to find like this, it's just another layer. But those are really good questions that you should ask the provider
Right,
that you're working with. Like, how familiar are you with
right.
the pharmacies
Mm-hmm.
in this
Yeah,
area? Which, which narrows accessibility even,
yeah.
like it dwindles it down like even more, right? And so because um there's not a lot of individuals in this field that are diagnosing and or prescribing medications in general. And so
Right,
then now we're trying to find somebody that
right. And then we narrow it down even
is like
more
even
into the right.
familiar with ADHD
Exactly.
and or doesn't have like negative opinions about ADHD.
Hmm.
And then from there, and now you're thinking about like, is that person familiar with the system and the process in order to be able to access medications? Um, and does that individual not hold any additional biases against all of my other identifiers? Um,
Absolutely. Absolutely.
and and that is just really extremely difficult. So I don't know how uplifting this conversation was.
Well, I think just the having the knowledge of that and for patients or potential patients, I hope it will give them confidence to ask those questions because I'll go out on a limb and say that if the provider is resistant to answer those questions, then
Hmm.
it may not be the best fit for you because you
Yeah.
need someone that's going to be willing to communicate with you and talk about best options. And yeah, I realize that does narrow the field a bit, but I promise you these providers are out there. And
Hmm.
I'm doing a class in May with a couple of other ADHD experts to help educate specifically PMH and Ps, but I think we're going to have some therapists and things like that on board too. But around that treatment algorithm and the things to be more aware of, because education is needed, and we are aware of
Hmm.
that as a field and as providers. But for the patients right now, doing the best you can to find that person. If you have a friend or family member that's being treated and they are they have a good relationship or a good rapport with their provider, then maybe try to connect with that provider. Um, but trying
Yeah.
to find someone that at least you don't have to. It's not also then a battle of sorts with the provider in addition to the other things that you might have to deal with
Right.
from that standpoint. So, yeah.
And then just access coaching to get you through this process.
Absolutely. Therapy and coaching. I don't think, I think like what you mentioned before, it's ADHD is kind of sold that way. ADHD, go get your meds. ADHD, go get your meds. So a lot of times people are not thinking about therapy or coaching, and sometimes they don't even know it necessarily exists.
Hmm.
So definitely maybe even look at that first because it might be harder actually to get in with a therapist, but get on the list. I tell patients that all the time. Like this 2 months is going to pass either way. So get on the list, at least get on there and you will get in. But if you never even sign up, you never get in.
Right.
So yeah, I tell patients all the time, we got to do both things. It's like wearing both shoes. Med is one shoe, therapy coaching is the other shoe. You're gonna be better if you got both shoes on. So
Yeah.
let's do it that way. Yeah.
So for those that are listening, I hope you feel empowered with a
Mhm.
series of questions that you
Yeah.
can use in order to access what you need from this conversation. Naomi, I want to thank you for joining me here today. And then for those that are listening, I do have availability. So if you're looking for an ADHD coach, just go ahead and contact me. You can send me a DM, and all my information is on my Instagram page as well. And then Naomi, is there anything that you would like to share? Or
So, like for nurse practitioners or providers, I am hosting a webinar in May. Yeah, in May. It's either going to be the 17th or the 31st, but it's going to be from a psychological and a medical kind of standpoint. And so the goal is to explain ADHD like from the beginning, like the wraparound kind of idea that it's not just medications, but it's also therapy. And we'll talk about exactly what's going on in patients' brains and what the meds do in regards to that. So it's like an 8.5 hour long class, but it
okay,
also has, yeah, it's a long class, but it also has like 8 CEs. So you'll be able to get
okay.
continuing education credits. And if you follow Cardinal Academy, there'll be information on the Instagram about that, about how to get on the mailing list to get updates about that once we have it all up for signups and registry and stuff.
Are you offering that for coaches too?
Sure. You could certainly join as a coach. I think it could be helpful because I think that's maybe a little bit of the gap there, is that as a treatment team, maybe we're
Mm-hmm.
not as connected as it might be best for us to be, so that we as like clinicians or prescribing clinicians understand the coach's point of view, and then coaches or therapists understand the prescribing clinician's point of view.
Yeah.
It's not that anybody's right or wrong. It's just a matter of everybody being at the table to help this patient. So I think it actually, yeah, could be a really good idea for coaches to be involved as well. So you can kind of see that side of
Yeah,
things.
because I think the coach training around ADHD varies widely.
Hmm.
Um, And if there is an opportunity for the different disciplines to be able to fully understand each other, I think that would be really beneficial, especially for the coaches. Like, there's so much missing from ADHD coaching training, depending on where you got it from and depending on who's teaching it. There's a lot missing, and so, but it is helpful for me. I mean, as a coach, I can speak for myself, like as a coach, knowing if somebody's accessing medication or not. And so then, and, just being able to help support them if they're trying to build some type of routine and some patterns around taking their medication. Or if you're talking to me and you've taken all of the things, like knowing what I'm walking into is actually really helpful.
Hmm.
And so then I can better support you in that
Yeah.
process.
And the
Yeah, so I think,
collateral information is huge. And I talk to patients again about that all the time. You as the patient, you as the individual being treated, you are not going to see yourself the way other people see you. And the way other people
mhm,
see you is very important. Because the way I have sat down with, a patient and a spouse, or a patient and a parent, and they honestly do not realize, because again, ADHD is a matter of cognition and memory.
mhm,
They don't realize, they don't remember talking over people all the time, or they don't remember that they're maybe louder in situations that they don't need to be very loud.
mhm,
Like they don't see that in themselves. So if I can reach out to the therapist and say, hey, she's been on, whatever medication for 4 weeks. Have you seen any changes? Because a lot of times the patients don't feel like there's a change, but other people do see it. And so if I
mhm,
can get from another clinician, actually, yeah, she hasn't been late a single time. When she's usually 10 minutes late every week. Or she actually did her homework this week. Like,
mhm.
you see it from somebody else's perspective, then the patient can see it. So if we're more open to sharing and connecting with other providers, I think it only benefits the patients.
Yeah, and I do that within my own practice. If they want me to have conversations with their
Hmm.
other providers, then
Yeah,
I'm open to that because, it's about wraparound services
yeah.
essentially. The same thing when I work with clients around, just when I think about writing contracts or with employers that are paying for services
Hmm.
for their employees around ADHD coaching. I'm also like, okay, well, who's talking to the manager about this? Like, this isn't just the ADHD that is getting supports, but it's also the entire organization that also needs some additional support. So they're not creating a problem, then
Exactly.
now I have to coach somebody through.
Mhm.
Like I wouldn't have to coach this person through this problem if you didn't create it in the first
Right.
place. And
Exactly.
so like now we're wasting everybody's time. Like you're paying to provide a solution for something that you could have just prevented.
Exactly.
Um,
Exactly.
and so I try to make sure that organizations that are paying for ADHD coaching for their employees also know that like
Yeah.
this isn't just about them. This is also about you too. But anyway, I feel like there's a whole other conversation, and I'll talk for like another 25 minutes about that. And I have to run because I need to
Yeah.
put my kid to bed. But thank you so much again for that, and I'll definitely look out for your information and send it to me so then I can attach it
Yeah.
to the
Absolutely.
replay of this, so people are aware, for the practitioners that are listening and the other coaches that are listening. And I'll share it with my other coaching networks too to tell them like they need to do this.
Yeah.
But thank you so
Yeah.
much, and I appreciate
Thank you
your
for
time.
having me. Absolutely.
All
Thank
right, I'll talk to you
you.
later.
Alrighty. Bye bye.
Bye.